For someone who is depressed, they could easily live inside their hoodie um, all day and all night, because depression is one of the most debilitating, ugliest, most awful, horrible, negative, downer diseases that could ever affect anybody. And I have been labeled a major depressive. And I used to be a normal guy, having a great time in life, and all of a sudden this very colorful life of mine started to turn gray. And every year it got a little bit grayer, and I thought I was just getting older, and that's what was supposed to happen. But it wasn't. And it got to the point where I stopped going to work. I had $1 million a year job on Wall Street, and I could get away with not going to work because I was a big producer. And I had a radio show, and as long as I did the radio show for 20 minutes a day, I'd be fine. I could do that from anywhere. I could put on a show through my depression. But anyways, I'm going to take this hoodie off in a second, but I remember a couple times tying my hoodie down like this around me so that I could just breathe. And I didn't really want to breathe. I didn't want to be alive. I didn't want to have to deal with life, which is very unlike me. My name's Tom Reese, and I am a depression survivor. I just watched a young lady's account of her own depression. The name of it on YouTube was Lauren Live Journal, and it was from July 16, 2008, and it's just called Major Depressive Disorder. Okay, if you want to see somebody in the middle of a major depression, look at that Major Depressive Disorder tape. It's like 4.5 minutes long. There's a blonde girl who is talking about everything she's supposed to be doing to feel better and how she doesn't feel better and wants to basically die. I have been in that place, and I went from a very happy-go-lucky kind of guy who did and loved everything, loved people, loved being social, loved everything about life, to a guy who really couldn't deal with anything. And I got into drugs and alcohol real badly, and I think it's my belief that a lot of people who do get into drugs and alcohol do so because they're depressed and they're trying to escape the depression. And what becomes self-medication, or what starts, I should say, as self-medication, becomes addiction. And I really, truly believe that at least 80% of people who are addicts or alcoholics start drinking or taking drugs to get around their depression. That in turn, taking the drugs or drinking, makes the depression worse. So it then kind of becomes a catch-22, and the person will drink more and take more drugs to try to feel better, and they'll actually, when they come down, feel worse. I want to provide a little bit of a quick explanation for those of you who are interested in depression and why you're depressed, to how you can survive it and what it takes. Because I've come out the other side at this point of a depression that got me into drugs and alcohol real badly, that got me into depression to the degree that I wanted to commit suicide, and I am the last person on this earth who ever thought I could even think about suicide. I lost a brother to suicide when I was about 30, and I went into treatment for my depression when I was about 46. I'm 52 now, but a kid at heart, and a kid all the way through, who loves life again. But I didn't like life when I was in my 40s, and got to the point where I was partying so hard to try to feel better that I honestly, when I got into the hospital, I ended up in a mental hospital. I got into the hospital, and basically they were asking me a lot of questions, and I guess I kept saying I'm at the end of my rope. And they interpreted that as suicidal, and indeed diagnosed me as depressed to the point of suicide or suicidally depressed, which I never thought I could get to that point, but I did. And for those of you who aren't or haven't experienced depression, you very well might, because the National Institute for Mental Health estimates that about 15% of Americans get hit with depression every year. It can be triggered by anything, that's very negative in your life, the loss of a person or a marriage or something that means a lot to you, and that can trigger the depression. But a major depressive episode is very different than being just bummed out and down and blue. A major depressive episode involves almost being immobilized and so consumed with negativity to the degree that you don't like or care about food, you don't like or care about sex, you don't like or care about life. And it's indescribable what that feeling's like. I can only tell you I'm terrified, having been treated and now on an antidepressant. I'm terrified that one day the antidepressant won't work and I'll have this feeling come back over me. It's that bad now that I'm out of it and I look back on it. It's that scary. I looked at it as my big black cloud before I was treated, because I could sort of see it coming 2 or 3 days away, or feel it coming, I guess. And it was like a really dark cloud that would slowly envelop me. And as it enveloped me, I became less caring about everything in life, and my concentration levels diminished. I mentioned in the beginning of this, I had $1 million a year job on Wall Street. Well, it involved really intensive financial strategic stuff and a lot of reading and strategizing, and I'd gotten to the point where I couldn't even read a column in the newspaper. It got so bad. And when I went in for treatment, I did so because I thought I was experiencing early onset Alzheimer's. That's how bad it was, my concentration. For those of you seeing doctors, there is no, I'll tell you a few things the doctors won't tell you. What I'm doing is looking for time on this video because I don't want to go on too long. Doctors will prescribe antidepressants. Antidepressants will help cure your depression. I did talk therapy as well as antidepressants, and after I stopped using the drugs, which I was on opiates, cocaine, just about everything except heroin. Thank God I didn't try that, because that's really a tough one to break. But the amount of opiates I was doing, I might as well have been doing heroin. And drinking, and I've always loved to drink. My whole life I've loved to drink, but I've handled it, basically, and not, lost a job or killed somebody or done something crazy. But when I got really depressed, the drinking increased to the point where it wasn't really working. I needed other things, and that's where the other drugs came in, starting with back pain pills, which I found gave me some relief. They helped me not feel the depression so badly. But what happens is you have some neurochemicals in your brain that are basically 4 in number of major ones. And the 2 that matter right now for us are dopamine and serotonin. And those are kind of considered the feel-good chemicals of the brain. Now, you'd think that they'd be able to measure these chemicals and be able to tell you, you're deficient in dopamine, that's why you're depressed, and so we need to give you XYZ and get your dopamine levels up to a certain level. Well, all that's happening in the brain, and they can't get past the brain-blood barrier to measure these things. So they can only measure like the enzymes in your blood that show that you have dopamine there. And it's a very inexact science trying to measure dopamine and serotonin levels. So they can't. And they just assume that if you're depressed, you're low on dopamine or low on serotonin. And so they apply these antidepressive drugs, which between you and me, the doctors don't even know how they work. No doctor can tell you what the action of an antidepressant is. They'll just give them to you. So you have to, as a patient, totally manage your doctor in terms of being able to say, and I've grown up in a medical family, and I was almost married to a doctor, so I don't have a fear of doctors or look at them like God or have a problem talking to them. And you need to talk to them like people. and manage them if you're having depression managed by a doctor, and say, look, this isn't working. I need to try something else. And you need to manage your medications and what you're doing. I would, in getting my depression treated, readily tell my doctor very impatiently, this isn't working. We need to try something else after being on something for a couple months, because it does take 30 days for a lot of the medications to work. But even after I was treated, there came a point where I had a fight with my father. And my father is a pretty famous doctor, and I worship him. And I had a really bad fight with him, and this is after I was treated. And the fight triggered a depression that led me to thinking suicidally, which I'd only thought of a couple times, and it really freaked me out. This was shortly, probably 2 years into being treated. And I was thinking things like, my dad, my own father, probably thinks more highly of the other 6 billion people in this world than he does of me right now. In other words, if the world were a ladder, I'd be at the very bottom of the ladder. And for this great man to be thinking of me at the bottom of this ladder, how terrible that was. And that I would be better off not being here, not being on this earth. You don't care about life, people that you love. You can't feel love. You can't feel much of anything except badness, blackness. And people who feel bad, if you watch this one video I've mentioned a few times now, and I just watched it before doing this, and it made me decide to try to do a video that helped people know there's hope on the other side. And when you get treated, you can actually be happier than you ever were before. And I'm now happier without the drugs and alcohol and without the depression, obviously, and being treated than I ever was before. For me personally, I found God again, which I'd lost pretty much throughout my whole life, but that's helped a lot. And for those of you who aren't religious, this isn't some God thing. That's not what cured me, but I think I was just better able to communicate and feel. And for me, I found my way back to God, put it that way, after I was treated for depression. For those of you in depression, having a major depressive episode, there is hope, and you just have to hang in there like by your fingernails until you get the right combination of medications. Even after I was treated and I was on an antidepressant, when I had that depressive episode, I ran to my doctor and said, get me off this, put me on something else. That wasn't working. I had a thought about suicide, and put me on Abilify on top of everything else. So I have 2 antidepressants, and get me off this mood stabilizer. I don't think it's letting me feel happy enough. So again, you have to really manage your doctors. On that note, I'm going to be starting another website. The one site I have now is soberlivingsearch.com, which is about and for people who have come through drug and alcohol treatment to find a sober living, because it's really important, especially if you've had depression with your addictions or alcoholism or whatever, that you get into a sober living and somewhere that's stable, and you're not fighting with your relatives or your wife or your spouse or whatever the case may be, and get into a stable atmosphere. Sober living is really the way to do it, and that helped me get better a lot. So I'm a big sober living or halfway house advocate for people coming out of the drug and alcohol treatment programs. You can see your doctor more readily and just kind of get it together from a safe place if you do that, take that angle. And it sort of guarantees that you're going to get better, if I may say that. And the only other thing I want to say is manage your doctor. They're not God, and they can't see into your head as much as you think they may or that they should. They don't. And basically, you're just another patient of theirs, but you must remember, you're paying him. He's in your employ. He is an employee of yours in a sense, and so you have to manage him as such. You have to tell him what your needs are and what's not working, especially, so that you can get something that works. The period of getting better takes different amounts of time for different people, depending on what you've done to yourself in terms of the drugs and stuff. took me about a year to start feeling normal again. And after a year, I started feeling really comfortable with myself, but it took that long. I still isolated and didn't tend to go out a lot, which, again, if you're listening just to find out about depression, people who are depressed isolate tremendously. You don't want to deal with other people. You don't want to bring your blackness into their lives because you feel so crappy about yourself, and there's nothing about yourself you like. You don't like the way you look. You don't like the way you feel. You may eat a lot and start gaining a ton of weight, or you may not eat anything and you may start getting really skinny, but it doesn't matter. You don't care about the way you look. You don't care if you take a shower, shave, or shit. It's that bad. So if you're dealing with somebody with depression, please have empathy and just talk to that person. Realize they can't snap out of it. It's a major condition that is not something that you can just snap out of, and that's one of the worst things you can say to somebody who's depressed is, come on, snap out of it. It's like having someone have cancer or diabetes and their blood sugar's off, and you tell them to snap out of it. Well, they can't. But it is treatable, and you have to make yourself, depression so bad that you would just as soon lie in bed and not do anything than you would get treatment. Even though I'm telling you treatment can get you better, I understand that you would rather just lie there in bed and do nothing because that's easier, and you don't even care if you get better. You feel so crappy, if that makes sense to anybody. I hope this has helped and does make sense. And I was going to mention the site I'm going to start is going to be called Good Doctors, Bad Doctors, the good, the bad, and the ugly, where people can report doctors who've been effective and done good work for them, or doctors that have been ineffective and have not done good work. So it'll be a site of the two extremes, not for docs that are just okay and in the middle, but for doctors that you want to tell other people to avoid, or doctors that you want to point other people towards. And it'll be called something like Dr. Tom's site in my dad's honor. That's it. Tom Reese signing out. And if you're depressed, whatever you do, life is worth living again, and you can feel that it is, even though I understand as well or better than anybody what that feeling of not wanting to live is like, and how easy it would be to just take yourself out, and that seems like the easier and better way to go sometimes, but it's not. So don't do that. People miss you, people love you, and you will realize that again when you get better. You can add a lot to this world once you feel good again, and feeling good again is right around the corner if you go get treatment. So go get treatment. Tom Reese signing off. Take care. Bye.